Thank you so much, Jacqueline, for that insightful session. Welcome back to the 8th session today on day 2 of the Reach Out Woman Festival 2023. My name is Adenike Oyetuni Lawal, and I'll be moderating this session with 3 amazing women. 2 are here physically, and the 3rd person will be joining us virtually. I have here with me Oyeyemi Aderibe, as well as Dr. Nini Iyizoba, and Loretta Amuso, who's joining us virtually. Our session is about reproductive health, and we're talking about resilience through all of the issues that these 3 women have experiences with. Dr. Nini is, of course, a medical doctor, and she'll be talking to us about that from her own standpoint. But very briefly, I'm going to be talking about who Oyeyemi Aderibe is. She's a business lawyer with multi-sector experience, advising most of Nigeria's foremost businesses on compliance, governance, and sustainability, and has done this for over 10 years. So Oyeyemi, thank you so much for coming.
Thank you so much.
You're welcome. Dr. Nini is a medical doctor, an advocate for women's health, an entrepreneur. Her journey to become a medical doctor began at St. John's University in New York, where she received her undergraduate degree in biology, pre-med. After her graduation from St. John's University, she went on to become a senior certified pharmacy technician and worked for a year at Walgreens Pharmacy to help gain knowledge about drug pharmacology, and on and on and on. And our 3rd panelist is Loretta Olubunmi Amosun, who is a certified global professional in human resources and HR leader with over 16 years of professional experience. She's a well-rounded professional who has gained significant expertise in developing HR and management strategies for organizations at various growth stages. Loretta, so beautiful to see you. Thank you for joining us.
Thank you. It's so great to be here too.
Awesome. So let's get to it. Oyeyemi, in 2 minutes, I want you to take us through your reproductive health journey and what that has been from when you started up until now.
Thank you so much, Adenike, and also to the Reach Out Woman community for having us today. So I would say that I was pretty healthy growing up, so I really never had to see doctors and all of that. But the first time I had an appointment with my gynecologist, I was over 20. So I had gone through puberty significantly, and I'd had painful periods, I'd had different reactions, different issues, but nothing major. When I had to see my gynecologist, it was because I had done a scan and then I had seen a fibroid or a growth which hadn't been named at the time. By the time I saw him, it was a fibroid, and he advised on different things that I needed to do, including getting married and proceeding to...
How old were you again?
I think I don't remember exactly, but I think I was 23.
Okay.
Yeah. 23 or 20. It was before my 25th birthday.
Okay.
Yeah. So you need to get married, rule 1, because I asked, what do I need to do? Right. You need to get married so that you can start having children, and then it can recede the growth of the fibroid. You can live healthy with it. You know, some lifestyle changes, and I did live with it till about, I think I was 30 or 31 when I had to take it out. And at that point, it was dangerous. It was sitting on certain organs. It was within my womb, which was potentially dangerous for reproduction as well. And it was already affecting my wellness and lifestyle. That entire situation was even a difficult process because I nearly lost my life even trying to take it out, right? But I'm grateful for that because I learned a lot, you know. And then also, I'm a mom today. I don't have the fibroids anymore. I've had to go through motherhood, go through also other processes, including assisted reproduction, which in plain terms, most people would refer to as IVF, but that's not, IVF is not the only thing, right? But different things, you know, and so that's the story, you know. But
that's what summarizes your journey.
The journey is way more than that, certainly.
Okay, so Loretta, I'm coming to you, and I want you to take us through your reproductive health journey in 2 minutes as well. What has it been from when it started up until now?
Okay, the first time I think I may have suspected something was one day in the office, I had gotten to the office really early and my period started that day. And all of a sudden, I got into the bathroom, the pain became unbearable, and then I slumped. The next thing I remember was my colleagues had rushed me to a hospital close to somewhere in VI, rushed me to the hospitals, and then I saw so many gynecologists all around me throwing different questions at me. But I was not married then. I thought it was just a painful period. I'd always had those anyway. So 2 days in the hospital or 3 days, I was discharged after that. And then we got married. 1 year, nothing. After 1 year, because of my age, I was approaching 30. The advice was go see a gynecologist. And then they started to throw everything at us. You have this, you don't have sufficient this. It was just crazy. And that was when we knew. And the annoying thing was they didn't even give us options like, okay, maybe you can start with this process. They just said the only way out for you guys is IVF. And that was how we were thrown into the deep end. Nothing prepared me.
Okay, so both ladies have talked about how it has affected their fertility, but it's very important for me to talk about reproductive health and what a simple Google search, shows. It says reproductive health implies that people are able to have a satisfying and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. It's very necessary to also state that a woman's sexual and reproductive health consists of some things like menstruation, fertility, cervical screening, contraception, pregnancy, sexually transmittable infections, chronic health problems such as endometriosis and polycystic ovarian syndrome, as well as menopause. I mention this because the two experiences we've heard now have touched on fertility. Dr. Nini, both of them mentioned that the very first time they had a visit to the gynecologist, they had long started menstruation. You are a doctor. I'm not going to put you on the spot to ask you at what age you first visited a gynecologist. But how do we correct this now, knowing full well that we hear people share similar experiences, and most of us share these experiences from a standpoint of, had I known, I would have done better. So what do we do? How do we tackle the frequency, how early we should visit, and what information would you love to share with women who have daughters, biological, adopted, or just have female children and male children around them?
Okay, that's a lot of questions in there, but I'll start with how important it is to create awareness about visiting your doctors. I want to say that regular doctor visits are so important and they're so neglected. People wait till there's a problem before they visit your gynecologist, even just regular checkups. People just wait until there's a problem, especially when it has to do with like reproductive health, people trying to get pregnant. You can't wait till you've gotten married and nothing has happened. That cannot be your first visit to the doctor about, your fertility health or your reproductive health. So I think what we're doing is right, just talking about it more, educating people more, letting them know that just listen to your bodies. Don't wait. Even if you're not listening to it, don't wait for something to be wrong. Just go for your regular screening because, that will tell you there's chemical imbalances, structural deformations. There's so many things that could be going wrong that the more you delay, the more it gets worse, With endometriosis, like girls have regular painful periods every month. And I mean periods that take them out of school, they can't function. And they think it's normal. And you as a parent, you see your daughter going through that and you just say, okay, in 2 days she'll be fine. No, your periods are not supposed to be that painful. You might have some discomfort, but it's not supposed to be that painful. So if you notice something like that, take them to the doctor. It's better to start early. I don't want to say prevention. I'm just saying detecting something early is better because you're able to start tackling the problems earlier on. If and when you get to the doctor, they're able to tell you, okay, this hair growth on your child is not looking regular, let's run some tests. Knowing is better than not knowing, and it doesn't hurt. So that's what I'm saying. When you create more awareness, education, telling people more and creating more awareness about what the importance of these regular doctor visits are, I think I think people would listen more hopefully and do the right thing. Yeah, because you cannot wait.
You can't wait. You're talking about the medical checks, and what came to mind was we very rarely even have checks for our eyes, our ears, teeth, dentists. Then you now say reproductive parts. People are like, is there something wrong? Are is everything okay? I'm hopeful that we will take out from you what you have said, that you need to do that. It's part of it. Is there an age mark? Is there,
I would say to your parents, if your daughter is menstruating, she's already, showing signs of womanhood. I'm not saying she's about to get pregnant, but just take her for regular checks.
Okay.
From then you could detect, if she's ovulating. So from there you already start seeing signs of, okay, whether she's ovulating, if you look at her physical appearance, stuff. Just you as a mom, once your daughter starts, menstruating, I think it's time to make sure they start going for their regular checks. Your pap smears, there's so many tests that could tell you that there are issues that could be corrected long before, fertility or pregnancy you're ready for pregnancy.
Great. Loretta, I'm going to come to you now. You have a book, and I read the book a few months ago, and an offshoot of reading the book was me asking that we go on an IG live. And one of the things that we talked about during the session, of course, was the depth of your journey, the years that you had to wait, the resources, every single form, mental, emotional, religious, and most importantly, financial. And I had asked you a question at the end of the session to put a mark as to what it cost you from the start of the journey, to the eventual arrival of your amazingly beautiful son, by the way. And you gave me an amount. After that session, you came back and then you said, no, I went to check the books and it was way more than that. So now tell me, how much exactly did it cost to arrive at your son, from the journey of his arrival and then to seeing him on this side of the earth? How much did it cost you?
We waited to have him for about 8 years. Within those 8 years, we had 5 IVF cycles, and he came at the 5th attempt. So from the first cycle to the 5th cycle, it cost us nothing less than 20 million naira. However, this excludes all of the other tests that HMO covers for, the routine investigations and all of that, visits to gynaes and all. I'm just talking about core IVF treatments and stimulations and all whatnot that goes into it, inclusive of the surrogacy.
Okay. So what I hear you say now is he eventually did come through surrogacy, right?
Yes, he did.
How easy was it for you to accept that reality?
It's not the easiest thing for a religious person, first off, because you always, all the belief, the prayer points and all that, you would be the one to walk through the journey and experience motherhood with someone growing through you. And then all of a sudden, it's almost like you're hit with the decision that you have to make. It's either your life or you go with the better option. And there are options out there, so why not even take one of the options? And then at the time, we were even left with no other choice, because we only had, I think we had just 4 embryo left, because for each cycle, we would go from 11 eggs, sometimes to just 1 embryo. And for the first time, we had embryo enough to store. So we had 4 embryo, and the doctor was like, do you really want to waste the chance of trying to surrogate versus wanting to prove to yourself that you can get pregnant? And when the other complications came, they told me, of course, that endometriosis had been there before, but now we were dealing with endometrial hyperplasia, and they were trying to find out whether it was atypic or not. My husband and I just had to sit down and determine what was more beneficial: preserve my life, try this option that is also legal, and it's an option, it's a God-given gift. Someone is willing to rent a womb and carry a child for us, and why not? And then thankfully we were also able to afford it. And the good thing about IVF and surrogacy is that they are plans. You don't have to pay all of the money at once, so it's with installments and with every milestone that you achieve, and that way we were able to spread it. It wasn't an easy decision, but here we are, and I'm
here we are. He's so cute, by the way.
Thank you.
You're welcome. She talked about being a religious person and accepting that reality. And I know you're a Jesus baby. I say this because You talked about assistive reproductive technique to getting your children, and accepting that reality from the standpoint of religion, which Loretta just talked about. Well, I want you to, touch on what they say in medicine: male factor-based fertility, female factor-based fertility. How was that reality for you? We've had conversations outside of this, and you've talked about how that whole coinage doesn't really grade well with you. Someone is watching, and it's most likely, the man or the woman. How do you do it? How do you handle all of that?
So it's two questions, right?
Okay.
So the first thing, I think it's faulty thinking, right? I think it's faulty thinking to approach this conversation from a who's the factor, right? Because when you do things, when you're in this space, it's not a factor thing. It's we want to have children. It's a team coming together, people, right? And when the society has, the mentality is one of blame. Who is to blame for this result that we're getting or not getting, right? And if you're coming from blame, you will never get it right. You will never have the emotional stamina that is required for the journey, right? And in the society we live in, there is a default setting that says it's the woman all the time. But the reality is that just as the clock is ticking for women, the clock ticks for men.
You don't say.
Men can get sterile as well from not having sex. I'm not a doctor, but doctors would say it, right? So we always say, oh, the woman's clock is ticking, but the clock also ticks for men, right? And it's two people coming together. It's families expanding. If we look at it from the wellness point of view, we're looking, how do we get to the solution? I didn't have to do, my process wasn't very painful. My process, we arrived at it because, okay, you know what, we've been married 5 years, and let's just see. And we had a conversation with my doctor. My doctor's like, especially because you've had a fibroid surgery, you don't want a resurgence, you need to take it more seriously. So that's even what took us to the hospital. We weren't consciously in that space of we're finding people. We're having a ball, more or less. We were happy with ourselves. We're thankful for where we were. And we're just, living our lives rich. So we didn't feel that pain. And family support was also there. So we didn't have parents who were boring down on us and saying, go and do this. So IVF for me was actually an epiphany. I was like, oh, why do people cry and scream about this? This is medicine being an instrument of God's healing. This is medicine bringing to life God's work in our bodies. This is medicine creating God's work and giving people options. So even as a Christian, it was, oh my goodness, this is good news. Can everybody just start IVF in your first year? Go to your doctor. If there's something, find out. My first session, when my eggs were taken out and they put the babies in, because I lost the first time, right? So I'm a mother of children now, but it was a second turn, right? The first one, when they put in the eggs, the embryos, I was crying. And the doctor asked me why. I said, because I'm feeling the burden so many people feel and carry weights for 9 years, 10 years, broken marriages, broken homes. Whereas there is an answer here, right? And only if people knew and had the right support.
So that story for you is, it is actually God.
It is a God option.
Great.
And faith should not be a stumbling block to it. And our leaders, even in the faith, should embrace it as a first card. As you're starting, once you notice a problem, give them the card and let them try it.
Dr. Nini, nutritional, environmental factors that affect, influence fertility. Very quickly.
Okay. Besides the nutritional factors, environmental factors that we just take for granted, from our deodorants that we use every day, to soaps, to perfumes, to plastic bottles, warming your food in plastic bottles, all of that. These are all toxins. It's unrealistic to say that we can, get rid of every single toxin in our body, or, avoid them completely. But
when you're aware of these things, you're able to read your labels, you're more aware, you choose better, you make better choices when you're buying your household products and all of that. And with nutrition, just eat a balanced diet, be healthy, exercise, don't be overweight. And people always say, oh, as long as I'm doing all of these things, I can wait forever. I just want to let it be known that age is a big factor when it comes to fertility. The older you are, the harder it is. It's just a sad truth. So as you're doing all the right things, being healthy, just talk to your doctor early. I mean, if it's getting late, about the options you have, when it comes to your reproductive health.
Awesome. Loretta, my final question to you very, quickly. You waited many years and you talked about this Jesus part of it and wanting to carry by yourself. After I read your book, I knew that many more people need to speak up about their journeys because we can actually do it quicker. In your honest opinion, do you think that you could have tried faster, honestly speaking?
We did try early. Like I said, we started investigation 1 year after. Maybe the fact that I got married a bit later, close to my 30s, maybe that affected things. Because if I may have been younger than that, I may have hoped and believed in the miracle that would happen through my body. But we started 1 year after, and then after that, we went straight for the first IVF cycle, and then it failed. The second failed. The third failed. The second failed. I had to have surgery to take out the fibroids and some cysts that had been discovered to be a hindrance. And then we tried the third and the fourth, and then it looked like, okay, no, this is actually something else that needs to be investigated. So I would say that we started early on. There are certain things that determine how many times you can do. First off, do you have the finances? Because IVF doesn't come cheap. Second, the effect on your body, because for every stimulation, and God forbid the person now has OHSS, ovarian hyperstimulation syndrome, that's another thing that needs to be managed. And the response to the stimulation, how many eggs are you producing? For someone like me who had endometriosis, they could pump and pump and pump, and the most they would get would be 5 eggs, 5 follicles, not even eggs, so it's tricky.
Loretta spoke about is basically the fact that there are several other factors away from starting early that influence the outcome of the realities with your reproductive health. I'm hopeful that our conversing with these 3 amazing women has been able to convince you and not confuse you as to why it's necessary for you to take your health and more specifically your reproductive health seriously. Thank you so much for being a part of this session. I do appreciate it. Thank you so much, Loretta. Thank you, Dr. Nina. Thank you, Oyeyemi.